traveling in and outside the loop from Memorial to the Medical Center. Information you want to improve your day and make your life better. Live from the Channel 11 studios, it's Great Day Houston. And now, your host, Deborah Duncan.
Coming up on Great Day, can the lack of certain vitamins and minerals be the reason for your health problems, cancer, diabetes, eczema, and infertility? There's a simple blood test to show what your body is missing and how those vitamins and minerals could be your best medicine.
Welcome back, everybody. By now, most of us have heard about hormones. Your body needs them to function, and balancing your hormones is crucial to optimal health. Even the aging process is the result of declining hormone levels. That's all fine and good, but what the heck are hormones anyway? Author of Hormones, Health and Happiness, Dr. Stephen Hotze, is here with that answer. Hi there. So we have talked a lot about hormones, and people are starting to hear about all that now. Let's just break it down to what is a hormone, and there's more than one kind.
Right. Well, hormones are chemical messengers secreted by specific glands in our body that direct the cells in our body on what to do. Mm-hmm. They're messengers. They're secreted by the thyroid gland, the sex glands like women's ovaries, men's testicles, the adrenal glands. Our pancreas makes insulin. The adrenal glands make adrenaline, they make cortisol, which controls our stress. Adrenaline controls stress. They control our metabolism, they control our salt balance. And they all affect every cell in the body. They don't just affect specific cells, the entire body. And most importantly, the hormones affect our brain function.
If your hormones are off, you're going to feel it.
You're going to feel it, and you're not going to feel it just in your body, but you're going to feel it in your head. And that's why, historically, as doctors from way back to Hippocrates' time in Greek times, saw that there was a correlation in behavior, particularly in women, that was related to their menstrual cycle. They had no idea hormones existed. They thought there were humors in the blood, and these humors dominated them at certain times. And when women had, around the time of their periods or at the change of life, they knew that it caused some changes in their behavior, right, in the way they thought and the way they felt. They didn't know how to describe it. As a matter of fact, we didn't even discover sex hormones till back in the 1930s. It's been less than 100 years. So for thousands of years, doctors have tried to explain behavior based upon a whole series of concepts.
Things that didn't have any medical basis on some of them.
They didn't know how to explain it, and they tried treating it with everything from binding to diets and everything, but they discovered it was hormones in the 30s. And once we discovered hormones, then that led to a whole series of changes in the way the medical profession approached women. But even men's hormone levels decline. So it leads to a host of problems that are associated with the aging process. Right. The fatigue, the low energy, the inability to lose weight, can't think clearly, brain fog, insomnia, joint muscle aches and pain. Fibromyalgia is a very common diagnosis. Joint muscle aches and pain. Right. You go to the doctor, say, I got joint muscle aches and pain. He goes, you got fibromyalgia. And you say, what does that mean? Well, you got joint muscle aches and pains. You go, that's what I told you. Why do I have joint muscle aches and pains? Well, the common cause of that, in fact, 99% of the people, is low thyroid.
Wow.
Low thyroid, which goes completely undiagnosed because oftentimes physicians strictly look at a blood test and a blood level to make the diagnosis, rather than doing what we did 70 years ago or 60 years ago, was listen to the patient. We had to make diagnosis based upon clinical symptoms in the old days. Now you do a blood test. If the blood test falls within the lab range, you go, everything's normal. It must be in your head. And what happens? They get prescribed a drug.
To take care of the depression.
To take care of the symptoms, whatever the symptom is. You don't sleep well, we got a drug. You don't think well, we got a drug. You know, you got joint pain, we got another drug. So you got a host of drugs, all of which are toxins. Yeah, so drugs are toxins that have to be detoxified by the liver, and they compete with the liver. We have to detoxify a host of chemicals in the environment, and these drugs are not, by definition, drugs are not safe. I always recommend, let's try to address the problem from the natural point of view first and see if we can get at the cause and address the cause. If your hormones go down, why don't we replenish the hormones first and put the same hormone back in your body you used to have and see how you do. Yeah. If you don't do well, we can always give you drugs to mask symptoms, but why don't we try to address the underlying problem? Because if you mask symptoms, you still have the underlying problem. If you used to be here in your hormone level and now you're here and you don't feel well, why don't we fill your tank back up. I mean, this is not.
You just said you got to listen to the, and the patient will tell you what the problem is. And if you ask, what do you think your problem is? I think I have low thyroid. Well, guess what? 99% of the time they're right, because they've already done all the reading, they've studied it, and if you'll listen to them, give them a therapeutic trial of thyroid or try them on a little natural hormones and see how that addresses the symptoms. All right. Thank you very much. And you can catch Dr. Hotze on his radio show called Health and Wellness Solutions. It's a live call-in show with guests from the world of health and wellness on station 700 AM from noon to 1 Monday through Friday. And if you want more information on Dr. Hotze, call the Hotze Health and Wellness Center at 281-698-8698. Or you can log on to hotzehwc.com. We'll be right back.